A conversation that needs to be ongoing. That's the goal for this month. I spoke with 3 people passionate about spreading awareness. In each of my conversations, the message is simple.
Call 988.
Call 988.
988. We have to know that that is there for a reason.
988 is a national suicide in crisis hotline, a number advocates want etched into people's minds.
What we know by the trends is that here in Lane County, we average about 100 to 110 suicides per year. That's 100 to 110 people who would have lived another day, another year, another decade gone. And that adds up, right? In a decade, that's over 1,000 people. We only have 400,000 people in our whole county.
Conversation on mental health is something Jim Hensley is making his mission after his granddaughter McKenna died by suicide in 2021 at the age of 14.
My granddaughter was a quirky little girl, beautiful. She loved to do shopping. She loved to do makeup. She loved to go with her mama, my wife. For me, she was my fishing partner.
Jim now turning his pain into purpose. He was an early advocate for House Bill 3463, declaring October 9th as Oregon Youth Suicide Awareness Day.
So I think that it's just something in the climate that we're in right now, with our kids and mental health and lack of mental health facilities, that it's really an awesome thing to, to be brought forth and make everybody aware of it in Oregon.
On a personal level, Hensley gives out sweatshirts clearly spreading the message and remembering his granddaughter.
It took a long time, to be able to get past her and then to have McKenna's situation. I mean, it's difficult. Yeah. So I guess I'm living proof that getting mental health help, it does help. Really does.
Rhonda Hodafy's brother ended his life by suicide in 1995. She says the support 30 years ago was scarce, so she became an advocate she needed.
So Bobby, I'm the youngest of 5 kids, and Bobby was just a year older than me. And we were best friends. We grew up, we both had a medical condition that held him back for a year in school. So from my 2nd grade year on, we were in the same grade all the way through high school. And so we just were each other's best friends and, fought for each other in every situation. He was a steel mill worker. He worked really hard. He always worked hard. So I founded Oregonians for Gambling Awareness Organization, which I label OGAO, 30 years ago after I lost my brother to suicide. He had a gambling addiction, which we didn't recognize at the time as an addiction, and he ended his life. The more I learned, the more I studied about gambling addiction, and the more I found all the different aspects of life that it affects. It's people always go back to the money, like it's a money thing. How much money did he lose? That wasn't the bulk of what caused him to end his life. It was the self-esteem and the self-respect, and just knowing that he couldn't control something that the state was selling as entertainment, and he couldn't understand why he couldn't quit. Why he knew it was a problem more than we did. We didn't know it was a problem as much as he did. And so when I started looking more, I wanted to do something in honor of him. And so we started with a proclamation that we've had signed by the governor now for the last started in 1997. And it's a recognized day for his birthday. So his birthday is Problem Gambling Awareness Day. This year we switched it a little bit to Gambling Harm Related Awareness Day. But we wanted people to recognize and to know not only that it could be an addiction to gambling, but that it had a high suicide rate. 30 years ago, things are very different today than they were 30 years ago. And 30 years ago, we were laughed at, we were yelled at, we were mocked. I had people just telling me I should be ashamed and I should stop talking about it because suicide is a sin, it's a moral issue, it doesn't belong in a public conversation.
Hodafi, a preschool teacher, says she wants this topic to be normalized and conversations to start early, something she practices with her students daily.
I have 4 and 5-year-olds, and I have mental health first aid kit things in my classroom because I have kids that are 4 and 5 years old that have stress and anxiety. And the sooner we can teach people that it's okay to say, I'm scared, I'm nervous, I'm anxious, whatever it is, and we can hand over a little tool to help them, the better we're going to be in the future.
Lane County Public Health says there are plans on the county level in place to help those struggling in the community.
We've been working on building a stabilization center, and we're inching closer and closer to that project. We have the land, we have the partners, so it's on the forefront of our minds, and hopefully in coming months we'll be able to make that announcement that it's going to be a reality.
Reporting in Eugene, I'm Lily Taylor.